Hi everyone, welcome to the HPA weekly webinar series. Today the webinar is entitled HPA Employer Presentation. I'm Ryan Butler, the Director of Business Development here at HPA. And who are you talking to? Who is HPA? HPA is a technology and consulting company that works with brokers in order to engage with healthcare reform. We partner with agents, agencies, and brokers nationally to bring them technology solutions, private exchange sites, marketing tools, training, and leverage to help them be more successful. Today's presenters, I'm Ryan Butler, Director of Business Development here. I'm right the guy in the middle. Also joined by Kyle Easterling, who's the Business Development Manager, as well as Doug Foshee. So, topics of discussion, what's coming down the pipe? Today, Doug Foshee and I, we're going to be kind of showing you a little sneak peek here at our new employer presentation. This presentation is fully scripted so that you know exactly what to say to an employer when you meet with them. You can load up this presentation on an iPad, iPhone, Samsung, Galaxy, whatever kind of phone or tablet device that you have. Kyle Easterling also is going to be giving us an industry update, which will have some really interesting information about redefining defined contributions. So what else do we have up and coming? The next thing we have as well is the new Association Chamber of Commerce presentation. Next week, we'll be launching our new Association Chamber of Commerce presentation. It will be available in our members area. We want our partners to really think big, and what I mean by thinking big is going after large employer groups like those associations and chambers of commerce. These organizations want to continually build their membership numbers by maximizing membership value and offering more benefits and services to their members. This presentation is fully scripted, and you'll be able to effectively communicate why your individual private exchange is a comprehensive solution to the needs of a chamber or any type of association. So chambers and association, they have lots of small employer members who need an individual healthcare solution to combat the rising cost of group benefits. We have many HPA partners right now who successfully land large associations, and chambers of commerce, and employer groups. They're really knocking it out there. Also, too, next week we're going to go over our recruiting presentation as well, too. We've got a good recruiting promo out there so that any of you really entrepreneurial brokers who want to, make a little extra commission can go out there and recruit new partners for us. So we'll also be discussing that. But I'm going to let Kyle Easterling take over right now and give us an update. Take it away, Kyle.
Thank you very much, Ryan. Now, last week, we reviewed the IRS's clarification on their original September ruling regarding employer payment plans, also known as defined contribution. However, the news is so buzzworthy and impactful that we need to make sure everyone knows what is going on. Last year, some employers were providing pre-tax dollars to their employees for individual health care plans in lieu of a group policy. Unfortunately, the IRS struck down that setup in September and reinforced the notion mid-May with this Q&A posting. We are taking this information directly from the IRS site. So, after that bomb being dropped on the insurance market, what does it all mean? People are scrambling to find an easy way to shift employers from their group policies to the individual market without the safety net of pre-tax defined contribution. Sizable penalties are being assessed on employers who provide pre-tax reimbursement for individual health plans. Yet another drastic shift in the market will make employers, agents, brokers, and TPAs uncertain of what the right path is. And anyone employing the pre-tax defined contribution method will have to find a new market strategy. Now that we have mentioned what it means for the market, how will it affect you as a broker? First of all, if you have not been offering other benefits to complement individual policies, you should be. If an employer makes the decision to drop their group coverage, with or without you, they can easily come to the conclusion that some of the savings can be used for pay raises to help cover the individual policies. But why stop there? Is there a dental or vision plan in place? Could the life policy use some attention? Maybe their 401k contribution can be increased. All of these benefits and more can be provided through a private exchange. Secondly, with a pre-tax defined contribution option, dissolving group coverage could have been an easy decision. However, without the tax benefits of pre-tax contribution, the decision might not be quite so easy, and that is where we come in. You could spend hours spreadsheeting the tax benefits and cost analysis of an employer only to come up with an unfavorable or inconclusive result. However, with the reporting software provided by Health Partners America in tandem with your private exchange, you can expedite the process and get a definitive answer. Last but not least, employers need guidance right now more than ever. You need to be the broker that takes care of these employers and stays on top of all the new regulations. We provide weekly updates and monthly coaching calls to keep our partners up to date on everything Affordable Care Act. We also have our business development staff available to answer questions, but only if you're a partner. Recently, I have been responsible for some of the goofy and lighthearted pictures associated with our blog posts on our webinars and presentations. However, today, I have to give Eric Johnson some props for tracking down this picture to sum up the post. Some of you may recognize it from Planes, Trains, and Automobiles. The Affordable Care Act originally provided funding to trailblazing states to open up their own public state exchanges. The administration wanted the market to find the best way to administer the health care reform bill. Now that we are past our first open enrollment period, some states are actually backpedaling and decommissioning their state exchanges, Oregon and Nevada most recently. In effect, the states who dropped their exchanges are going the wrong way. What does it mean for you guys, though? Some of the state exchanges were cutting brokers out of the equation and not paying out commissions for on-exchange plans. Not so on the federal exchange. As more state exchanges either drop or let brokers into the market, the wave of change is just going to pick up even more speed. Do not get left behind. Because of the Affordable Care Act, group insurance policies in the small employer market are going the way of the dodo bird, disco, and the pension. Employees are paying even more year after year for their part of the policy. Deductibles are going up, less services for more money. You get the point. So let's talk planning. We have been preaching this idea for a little while now. Outside open enrollment, while many agents are twiddling their thumbs or sitting on their hands or just signing up the onesie-twosie customers, HPA-powered agents are out there busting up groups and raking in policies. Group policies are disappearing. We are all seeing it in the market. In fact, we have received numerous calls recently asking for help from both group brokers and employers alike. Once these policies are extinct, your capability of selling individual market plans to a group of willing employees will be severely limited. Do not wait. While these group policies are in place, they are ripe for the picking. A small employer has almost no reason to provide a group policy these days. Let me repeat that. A small employer has almost no reason to provide a group policy these days. Once they realize what they could save by letting go of their policy, they won't even give it a second thought. Not only is waiting going to reduce your potential market footprint, but you will also start to see more competition from the big guys. If you've attended a webinar in the past with us, you know that we are urging you to consult with employers right now before open enrollment. You may ask, How do I start the conversation with an employer to get them thinking about health reform and the individual market? I would like to introduce the hot and ready employer presentation as presented by our business development manager, Doug Foshee. Go for it, Doug.
Hello everyone, Doug Foshee here. I am another business development manager at Health Partners America, and I will be giving you a sneak preview of the employer presentation. Now, our primary goal with this presentation is to be able to show an employer their individual options. And what we do is begin to build the case for that individual solution for the employees. And what we want to do is lead the employer into possibly purchasing one of our reporting analytics that is available to brokers through us, and then, of course, potentially building them a private healthcare exchange. We have pulled case data from this last year and built some very nice tables and models to show employers. And now, this presentation will be easy to learn and use. You can load it up online or use our push-to-play version on a tablet. What we provide our partners is a presentation that will ensure business for them. And of course, the best way to do that is to go for that initial ICR. Get that first Insight Catalyst report run for the employer, and that's going to be your ace in the hole. Now, what's great is that we show the employer that they can offer other benefits. And that's another opportunity for you to make money. I am very excited about getting this in the hands of our property and casualty and voluntary members. This presentation will make it quite clear that you are now in the health insurance business. Not only that, you will be able to provide professional analytics and private exchange capability. So finally, here's the bottom line for this presentation. Run an ICR for the employer and help them nail down a decision. If they drop group, well, now you have the capability required to mass enroll all of those new individual consumers. You will not be leaving any money on the table. This presentation will not only be a great training tool for beginners, but a vicious weapon for our more experienced members. Now, we should have this thing published in the members area by Friday and a recorded version hopefully by the end of the month. We're also working on an employee presentation that can be used to follow up once the employer decision has been reached. So what I'm going to do now is going to discuss how to capitalize on the opportunities we have shown on the webinar today. So what you should do now is start building private exchanges, and we can help you do that. On top of that, we have the analytics, marketing tools, and presentations needed to consult with employers and exponentially grow your business. And these employers don't even have to be your current clients. Our private exchange broker blueprint product is made up of several parts. It's not just a private exchange site. And that's what sets us apart from anyone else out there providing a run-of-the-mill exchange site. So I'm going to break down the parts for you real quick. What you're seeing here is a sample of an HPA-powered private healthcare exchange. This is your fully customizable online marketplace. And this is where we want to direct your clients so that they can view the products you have chosen to show on your exchange. They can be sent to yourself for enrollment or to a call center if you can't get to them in time. And now this is just one of several templates and looks to our exchange site options. Our partners customize these with their own logos, or if they're working with an employer, the branding or company logo of that client. Another part of PEB is Agent Cubed. This is our client relationship manager that is attached to your exchange and allows you to track leads. And again, this is whether you are enrolling them yourself or sending them to the call center for support. So basically, you can be out advising clients, consulting employers with both the presentations and the Insight Catalyst report, and even writing policies yourself. Check Agent Cubed at the end of the day and see that a bunch of policies were sold by the call center. It really is like putting your business on autopilot. Now, in the past, we have discussed the competition entering the marketplace during open enrollment. Companies such as Walmart, USAA, and of course the large online houses like eHealth and eMarketplace. And you even have Amazon selling life insurance. So what do you think Walmart is doing? Well, of course, Walmart has a call center. And if you want to compete, you need one too. Again, it's an option. If you want to use it, it's there for you. If you're an agency of 3 people who are dissolving 100-man groups, it helps having 300 licensed agents available anytime. Now, we all want to work less and make more money. So let's say instead of spending about 120 hours writing policies for 40 people, and if we're running through healthcare.gov, we know that's how long it takes. You can instead close a deal with maybe 15 hours of work using our analytics and presentations, and then move on to the next employer. The call center is there and can help you service thousands and thousands of individuals. Now, when we get calls from employers and employees and brokers, they need a solution now. They need a solution on the fly, if you will. But it takes time to put these technologies and pieces into play. Why not have the solution now and be proactive? Next, we have our members area, which contains all of the content we produce. This is where you'll be able to find the up-to-date presentations and marketing pieces we are creating. New partners get especially excited when they see all of the professionally created and ready-to-use marketing tools that we provide so that they can immediately start marketing their private exchange site. Now, all of these marketing tools can be customized for you or your agency. Guys, it truly is a remarkable amount of collateral, and it's all ready for you to use. I would like to spend a bit more time on these Insight Catalyst reports. They truly are one of the more powerful marketing tools available to you now, and it puts our members head and shoulders above their competition. There really is nothing like it out there right now. Not only is it an incredibly strong marketing and consulting piece, but it includes a quoting engine and enrollment process. It allows you to create qualifying events. And remember, creating a qualifying event is the only way to sell individual policies outside of open enrollment. It triggers a special enrollment period that will allow individuals to get coverage now. Once the employer has this report in hand, you can potentially create a pool of individual prospects that can purchase health coverage through your private exchange site. And it doesn't matter whether it's on exchange or off exchange. So here is a look at the entire process when using an ICR. First, we need to collect the employer and employee's company information. We have a handy wizard, which is a quick 5-step process that shows you and tells you how to do that. We provide what you need to get a census completed, and once you drop it into the software from within your members area, well, boom, the report within a minute or two, well, maybe 20 minutes if you're quoting 1,000 people. But within that time, the report will be done, and you can check it out and even share it with the employer. Once you have the report, you can schedule a call with your HPA account manager, and they'll consult on how best to present and proceed with the data the report shows. We'll also review and answer any detailed questions you might have. Then, under your control, the employer is given access to tools that enable them to see the report, and if the employer chooses to, send it and review it with each individual employee. Now, the employee's view is unique to them and will show them how much subsidy they could qualify for, along with the possible plan options and instructions on how they can purchase or find out more about any of the plans shown to them. Now, this is actually a consulting and service piece, and by selling the report itself, you can generate immediate revenue. It's free for our members. Run as many as you like, but retails between $500 and $1,500. Now, when you're first starting out with us, one of the greatest ad campaigns that I have seen is to offer the ICR for free to the first 5, 10 employers who want one. It is an incredible way to drum up new business. So, even if the report actually shows that it makes sense for the employer to stay on their group plan for the time being, you've still provided them with peace of mind, you've strengthened that relationship, and you've made a little bit of money by actually selling the report. Honestly, you can see that the private exchange broker blueprint is a really unique and robust set of services, collateral, and support. But I really have not done it justice on this call. In a moment, I'm going to give you a website where you can go to learn more about it, and I encourage you to do just that. So finally, here are the pricing options for HPA membership. As a partner, this is what you're going to get for joining HPA, and this is whether you're on contract with us or paying month to month. You will, of course, receive your fully customizable private exchange site, a 20% revenue share if you're using the call center, all of the training on how to market your exchange site, customizable marketing tools that go along with that training, as well as a number of presentations for associations, staffing companies, employers, and employees. Your customer relationship management system, a great tool to use so you can live track all of the leads coming to your exchange. Your dedicated account manager will help you get set up quickly and out there in the marketplace selling. And then finally, free ICRs for the length of your membership. Again, run as many as you like for as many employers as you like. We also have an upgraded version of partnership, the Partner Plus. This is a great level for agents or agencies who are interested in building a team. We actually bump you up to 25% revenue share if you use the call center, and you can see a revenue share on your downline. You can actually recruit your competition and earn money off of them, and we will help you do it. You will get additional support from the business development staff, and we will help you build your team. Now, you can order right now, online or over the phone, and it's the best time to get started. We will help you focus on the small group marketplace here in the second quarter and begin shifting back into the individual marketplace and prepare for open enrollment. So, guys, if you get it, if you understand where our industry is going and you don't want to lose out, go directly to our ordering page at Private Exchange Broker Blueprint /order form. You cannot procrastinate. There has never been a more profitable time in our industry. And what do I mean by saying that? The uninsured, millions, literally millions of new customers. And can you tell me, what are you doing right now to get them, to take that and profit from them? Or if you don't want to go to the website, give us a call. We can help you get signed up. We have business development managers standing by to answer any questions. If you don't get it and you want to get left behind, well then, we will see you out there in the marketplace. Everyone, I'd like to thank you for joining us on the call today. I really appreciate your time, and I especially appreciate our current partners who took the time to listen to us today on this update. Our partners will have access to these tools and training soon within your members area. My team and I look forward to hearing from you, and happy selling, everyone.